Welcome to Conny's Health and Fitness Show, and today is my last day here at WNN AM 1470, because next week you can see me on my YouTube channel, and hopefully soon on TV. I'm auditioning heavily and learning how to deal with all the pictures and the camera live on air. So we will see what's going on there. So today my last show, and my very important guest today is Dr. Moss-Mellman. She's an MD. She is the Director of Clinical Breast Services at the Christine Lynn Women's Health and Wellness Institute at Boca Raton Regional Hospital. Thank you.
Good morning.
For coming. Good morning.
It's my pleasure.
Thank you. Because she's working, she's working. So she just jumped over while she was working.
I'm happy to be here.
Thank you. My topic today is breast cancer screening. No longer one size fits all. Let's see. We will talk about that. I have a question for you.
Sure.
Do you see a problem in breast implants and detecting breast cancer? This is so important to know because especially California and Florida, breast implants are all the time. You can see them everywhere. And is that a problem for breast cancer to detect it?
Well, Connie, I think that there's a couple of things that women need to know and consider before they make the decision to have breast augmentation. The first thing that women need to think about is, will it impact on their imaging? So when you do a mammogram, a screening mammogram, in order for it to be a good exam, you have to try to image all of the breast tissue.
Right.
And having the implants sometimes blocks the breast tissue behind the implants.
Okay.
So the technologist who's doing the exam has to do something called implant displaced views, in which when they do the mammographic imaging, they try to position or pull the implants so that tissue posterior to the implant is visualized. So, but I think that a woman has to understand that there's always the possibility that some of the breast tissue won't get fully imaged as a result of having implants. The other thing that women need to realize is that in order to do the implant displaced views, that will generally require additional mammographic views. So a woman who comes in for her screening mammogram, in most cases, is going to have 2 views per breast. In women who need implant displaced views, they're going to get additional mammographic views. So what does that mean? That means that there'll be a somewhat higher exposure to radiation.
Right.
So and when you think of radiation exposure, you also have to think of cumulative radiation exposure.
Exactly.
So radiation year after year after year.
Right. Right.
So I think the takeaway message is 2 things. 1, you might not fully visualize all of the breast tissue, and 2, it probably will require additional views, which means additional radiation exposure, in order to get the best imaging you can get with the implants.
Right. Thank you so much. If you want to listen to more, today at 1 p.m. and Sunday we have the replay at 7 p.m. Eastern Time, both Eastern Time. We are here in Florida, you know that. Tune in on AM 1470, and then next week starting on my YouTube channel, Conny Gyura, Gyura, and Conny is always with a Y. N-Y, Conny Gyura YouTube channel, and the show will be in the mix, your health and your money. See you there.